Welcome back, everyone. We're going to finish up on this blood vessel topic by looking at some of the regulatory mechanisms that regulate the blood vessels and blood pressure. So by the end of this recording, you should be able to discuss the mechanisms involved in the local and neural regulation of vascular homeostasis, be able to describe and compare the contribution of a variety of hormones to the renal regulation of blood pressure. We have spoken about that a bit in the endocrine topic too. Be able to identify the effects of exercise on vascular homeostasis and discuss how circulatory shock affects vascular health, just in very general terms. We'll start with the local control of blood flow, and tissues can actually partially regulate their own blood supply as a result of metabolic and myogenic control mechanisms. So the myogenic bit of that means that, it originates within the muscle cells themselves. So for example, you might get, myogenic responses in response to changes in blood pressure, or the regulation of the blood supply might be due to the intrinsic characteristics of the cells themselves. And blood flow itself can increase 7 to 8 times as a result of vasodilation of those meta-arterioles and the precapillary sphincters in response to increased rate of metabolism. And that makes sense, right? Because you want to have sort of more blood flowing through those capillary beds. Now, in terms of short-term control of blood flow, this is due to vasomotion. And vasomotion describes the periodic contraction and relaxation of those precapillary sphincters, either to open up capillary beds or to shut them down, depending on the conditions in the body. And this is auto-regulated within muscle cells. Okay. However, in terms of long-term local control, what we see is, the capillaries becoming more dense in a region that regularly has an increased metabolic rate. And we've all seen examples of this, right? For example, if you go to the gym and you start, lifting weights regularly, you would find that the capillaries, servicing the biceps and triceps muscles will become more dense in that region over a period of time. We're now going to look at the neural regulation of vascular homeostasis. And this is important in the minute-to-minute regulation of local circulation. Remember back to the heart topic, and we talked about the cardiovascular centers in the brain in terms of the cardio accelerator centers and the cardio inhibitor center that, regulates the cardiac function by either increasing or decreasing heart rate and stroke volume via the sympathetic stimulation from the cardiac acceleratory nerve or the parasympathetic stimulation from the vagus nerve. Now, we're also going to add to this the vasomotor center, which is also part of the cardiovascular center in the brain, and it controls vessel tone or contraction of that smooth muscle within the tunica media. Remember that changes in diameter of blood vessels is going to affect peripheral resistance, it's going to affect blood pressure, and it's going to affect blood flow. And the majority of these neurons will act, via the release of the neurotransmitter and noradrenaline from the sympathetic neurons. So this nervous control of blood flow in the tissues provides a means by which blood can be shunted from one area of the peripheral circulatory system to another area by increasing resistance. And as I mentioned, the sympathetic division via these sympathetic nerve fibers are most important. And these innervate all vessels except the really tiny ones, right? So the capillaries, the precapillary sphincters, and the meta-arterioles. So as I mentioned, the vasomotor center is located in the lower pons and the upper medulla oblongata in the brain. It has sort of two components, an excitatory part and an inhibitory part. The excitatory part is tonically active, and this is what results in vasomotor tone, right? So noradrenaline is the neurotransmitter, and that will cause vasoconstriction of vessels. The inhibitory part can cause vasodilation by decreasing that sympathetic output. And then there's also sympathetic stimulation of the adrenal gland. So stimulation of the adrenal medulla will increase the release of noradrenaline and also adrenaline into the bloodstream. This results in vasoconstriction in blood vessels when those hormones bind to the alpha adrenergic receptors, except in skeletal muscle, where vasodilation takes place because they use the beta adrenergic receptors. Okay, so that was just about blood flow. Now let's do a quick revision of mean arterial pressure or blood pressure, and then we're going to talk about how it's regulated. So remember, mean arterial pressure is slightly less than the average of the systolic and the diastolic pressures because diastole lasts longer than systole. And I've mentioned that a few times now. It's about 70 millimeters of mercury at birth, and then it's about 100 millimeters of mercury from adolescence to middle age, and then it's rises slightly in older healthy adults, about 110 millimeters of mercury. Mean arterial pressure, as we know, is calculated by taking the cardiac output, multiplying it by the peripheral resistance. And we know that cardiac output is calculated by taking the heart rate, multiplying that by the stroke volume. So the mean arterial pressure or blood pressure, therefore, is heart rate times stroke volume times peripheral resistance. So therefore, mean arterial pressure is proportional to heart rate, stroke volume, and peripheral resistance. So I'm not going to go through this with you now because I know that everybody knows this. What will happen to mean arterial pressure if any one of these three parameters increase? Okay, now if you're not sure, ask your subject coordinator in the tutorial. And two systems do regulate blood pressure, and they can be kind of categorized into short-term regulatory mechanisms and long-term regulatory mechanisms. In terms of the short-term regulatory mechanisms, this is facilitated via neural control. So we have baroreceptor reflexes that we have talked about in the heart topic. These reflexes change peripheral resistance, heart rate, and stroke volume in response to changes in blood pressure. We're going to go through that again. Chemoreceptor reflexes we have covered before, again in terms of the heart and heart rate. These are sensory receptors that are sensitive to oxygen, carbon dioxide, and pH levels of the blood. So they either get stimulated by changes in levels of those. And we also have the central nervous system ischemic response, which results from high carbon dioxide or low pH levels in the medulla, and will sort of respond and increase peripheral resistance. So let's have a look at these three a little bit more closely. So starting with the baroreceptor reflex, and if you got all this in the heart, you could skip through this bit, but I'm going to repeat it here. Remember, baroreceptors are those specialized stretch receptors. So they respond to stretches in arterial walls, and these are located within the aortic arch and the carotid sinuses. When your blood pressure increases, those baroreceptors are stretched more tightly, and that will, cause them to be activated, and they will initiate action potentials at a high rate. At lower blood pressures, then, the degree of stretch is lower, right? Because that, makes sense. Lower blood pressure, degree of stretch being lower, and the rate of firing of these action potentials then is slower. Now, within the cardiovascular center in the medulla, this receives this input and it triggers a reflex that maintains homeostasis. And of course, this is called the baroreceptor reflex. Okay, so when your blood pressure rises too high, this triggers parasympathetic stimulation of the heart. That makes sense, yeah? Cardiac output falls then in response. Sympathetic stimulation of the peripheral arterioles decreases, so therefore that leads to vasodilation. And the net effect of all of that then is that your blood pressure decreases and returns to homeostatic levels. Now, conversely, when your blood pressure drops too low, this triggers an increase in sympathetic stimulation of the heart. So you're obviously going to get heart rate and stroke volume increasing and cardiac output increases. There's also sympathetic stimulation of the peripheral vessels, and that results in vasoconstriction to increase blood pressure. And combined, all of these activities then do cause blood pressure to rise and to come back to homeostatic levels. The next mechanism we're going to look at is this adrenal medullary mechanism. And this is activated when stimuli result in a substantial increase in sympathetic stimulation of the heart and the blood vessels. So as I've put up here, maybe somebody's doing intense physical activity, or there's, a really sort of high level of stress, or a large decrease, say, in blood pressure, right? That will stimulate the medulla oblongata and the sympathetic nervous system, and those sympathetic nerve fibers then from the spinal cord to the adrenal medulla to activate the adrenal medullary region to release or secrete adrenaline and noradrenaline into the bloodstream. And these are obviously the hormones that do mimic the sympathetic stimulation of the heart to increase heart rate and force of contraction, and also to regulate the blood vessels by causing vasodilation of blood vessels to muscle, but at the same time causing vasoconstriction of vessels, say, to the skin and sort of all of the viscera, so those internal organs that don't need it in these times of extreme sort of stress. Now, this is a very short-term mechanism and it is very rapid. So I've expanded on this figure that I gave you in the cardiac topic. And we're going to put it all together here. So here we have our increase in blood pressure. So homeostasis is disturbed. That increase in blood pressure will cause, those baroreceptors to sort of stretch, become tighter, and they detect that increase in blood pressure. Remember, the cardioregulatory center increases the parasympathetic and decreases sympathetic stimulation of the heart. And here we're talking about blood vessels, so the vasomotor center decreases sympathetic stimulation of the blood vessels, and that is the baroreceptor reflex. The reaction to this is that the heart rate and the stroke volume decrease, blood vessels dilate, decreasing peripheral resistance, and blood pressure then decreases, so homeostasis is restored. Now remember, everybody, that the increased blood pressure will result in increased rate of firing of those baroreceptors. And remember, we're going to talk about decreased blood pressure now, where there's decreased stretching of these baroreceptors. That's going to result in decreased firing or slower rate of firing of action potentials. But regardless, that all gets integrated, that information gets integrated in the cardiovascular control centers in the brain to stimulate that baroreceptor reflex response. Okay, so here we've got the opposite, a decrease in blood pressure. The baroreceptors in the carotid arteries and the aortic arch detect that decrease in blood pressure. The cardioregulatory center decreases parasympathetic and increases sympathetic stimulation of the heart. And we know we want that, right? And the vasomotor center increases sympathetic stimulation of the blood vessels. Again, the baroreceptor reflex. But we also have to add in here the adrenal medullary mechanism as well, which will increase secretion of adrenaline and noradrenaline as well. And they mimic the effects of the sympathetic stimulation of the heart and the blood vessels. And that is the adrenal medullary mechanism. Okay, in reaction to all of that, then we get heart rate and stroke volume increasing. We get blood vessel constriction and therefore increasing peripheral resistance. Blood pressure increases and homeostasis is maintained. So you can see from all of this that there is this typical negative feedback to the heart and to the blood vessels to regulate blood pressure in the short term. We'll now look at the chemoreceptor reflex, which I have mentioned in the cardiac topic as well. So these receptors are monitoring levels of oxygen, carbon dioxide, and hydrogen ions. Remember, the more hydrogen ions in a solution or in the plasma will make the pH lower. So these chemoreceptors are going to contribute to vascular homeostasis as well. They're located in the aortic arch and the carotid sinuses, very close to the baroreceptors, and they signal the cardiovascular center as well as the respiratory centers in the medulla oblongata. Chemoreceptors respond to increasing carbon dioxide and increasing hydrogen levels, so decreasing pH, such as what you might see when you're exercising, by stimulating the cardioaccelerator and vasomotor centers. This will increase cardiac output and constrict peripheral vessels. And the inhibitor center is suppressed, right? That makes total sense, when you're exercising. Decreased carbon dioxide, though, and hydrogen levels, which lead to an increase in pH, then stimulate the inhibitor centers, and then the cardioaccelerator and vasomotor centers are suppressed. That decreases cardiac output and causes peripheral vasodilation. So we'll have a look at this in a figure form on the next slide. So with the chemoreceptor reflex, we're pretty much looking at the effects of pH and blood gases, okay? So remember that pH is inversely related to carbon dioxide content. The more carbon dioxide in the bloodstream, the more acidic the blood is going to be, and vice versa. And carbon dioxide itself, the amount of it in the blood is partly regulated through the respiratory system, and the respiratory system changes the ventilation rate in response to increasing and decreasing carbon dioxide levels in the blood. So again, let's start here, and this figure will look sort of familiar again, compared to the cardiac one. Blood pH increases. Chemoreceptors in the medulla detect an increase in blood pH, which is often caused by a decrease in blood carbon dioxide. And an increase in pH inhibits the vasomotor and cardioregulatory centers. Vasodilation then, the reaction to this is vasodilation decreases peripheral resistance and heart rate and stroke volume decrease. That therefore reduces blood flow to the lungs, which increases carbon dioxide levels in the blood. And as a result of that, with the increase in carbon dioxide levels, blood pH decreases and blood pH homeostatic range is maintained. Okay, let's have a look now and see what happens when blood pH decreases. So it gets more acidic. Again, those chemoreceptors in the medulla oblongata detect a decrease in blood pH, again, which is often caused by an increase in blood carbon dioxide. And a decrease in pH stimulates the vasomotor and cardioregulatory centers. The reaction to that stimulation, of course, is going to be vasoconstriction, which would increase peripheral resistance and heart rate and stroke volumes. They'll all increase. That increases blood flow to the lungs, and that increased blood flow to the lungs then will allow for an increase in breathing rate to get rid of that carbon dioxide, which then will decrease the blood carbon dioxide and therefore lead to an increase in blood pH. And homeostasis is restored. So you might need to go through these diagrams kind of slowly on your own, so you kind of get in your head exactly what is occurring. There is another emergency response, and it's called the central nervous system ischemic response. Remember that the word ischemia means a lack of blood flow. So this response produces an elevation in blood pressure in response to a lack of blood flow or oxygen to the medulla oblongata. It's activated, as I mentioned, in emergency situations. So when the blood pressure drops drastically below 50 millimeters of mercury. The neurons of the vasomotor center are strongly stimulated, and this increases blood flow to the brain if vessels are intact, right? So it is dependent on the blood vessels being intact. Like if there has been, an aneurysm or something where the blood vessel is not intact, this is useless, okay? But even at the same time, it decreases oxygenation of blood because there is a reduction of blood flow to the lungs, so there's going to be less oxygen uptake in the lungs. Over time then, if there isn't medical intervention, the lack of oxygen will cause the vasomotor center to become inactive. There's going to be then extensive vasodilation of vessels, and then that follows with a concomitant drop in blood pressure. And of course, that does lead to death if the central nervous system ischemic response lasts longer than a few minutes. We look at the long-term hormonal regulation now of blood pressure in terms of the renin-angiotensin-aldosterone mechanism, big mouthful. You can call that RAAM, or you can call it RAAS, or the RAS if you wanted to call it that, so the renin-angiotensin-aldosterone system. We'll look at the antidiuretic hormone mechanism, otherwise known as the vasopressin mechanism, and we look at the atrial natriuretic mechanism. The other two there, the fluid shift mechanism and the stress relaxation response, which I'll talk about very, very briefly, they don't involve hormones. Now, these three hormonal mechanisms all involve the kidneys. I'm going to start with the renin-angiotensin-aldosterone system or mechanism. Okay, so blood pressure at the kidneys helps to regulate renin release. Okay, so renin is an enzyme. All right, you can see here we've got a decrease in blood pressure at the kidneys, and that causes renin to be released. Renin then catalyzes the conversion of this protein made in the liver called angiotensinogen to angiotensin 1. All right, and then angiotensin 1 is converted to angiotensin 2 by this angiotensin converting enzyme, which is produced by release from lung capillaries. Okay, that angiotensin 2 is a potent vasoconstrictor. Okay, so it will cause arteriolar vasoconstriction to result in an increase in blood pressure, because remember the stimulus over here was a decrease in blood pressure to begin with. Okay, angiotensin 2, its activity is kind of short-lived though, but what it also does is it will stimulate the thirst center in the brain, and so we drink water. Okay, again, remember the stimulus was low blood pressure. It also stimulates antidiuretic hormone secretion from the posterior pituitary, and we know that that then will cause water reabsorption from the filtrate in the kidney tubules, so the collecting duct back into the blood, increase blood volume, increase blood pressure, right? Angiotensin 2 also does another thing. It acts on the adrenal cortex, and particular cells in there release another hormone called aldosterone. And aldosterone then travels to the renal tubules again, where it acts on sodium reabsorption. So sodium is pulled back in from the filtrate back into the blood. That will cause, more water to be retained, and therefore blood volume and blood pressure will be increased. Okay, and again, that's what you want, because your blood pressure had dropped, and that was the stimulus to begin with. So overall then we have water and salt retention. We have the effective sort of volume of the blood increasing, and then that sort of turns the whole system off. When we get to the renal topic, we will talk about this in a little bit more detail, about how aldosterone will cause that reabsorption of sodium back into the blood, but at the same time will promote potassium excretion by putting the potassium ion back into the filtrate. The next one then, of course, is antidiuretic hormone, also known as vasopressin, because of its effect on blood vessels. Okay, now I have spoken about this at length in the endocrine topic, so I'm not going to go into it in too much detail. Remember, it's blood pressure in the arteries and osmotic pressure in the hypothalamus that help to regulate antidiuretic hormone release. So those osmoreceptors are detecting increased blood osmolarity, baroreceptors are detecting decrease in blood pressure. That causes release of antidiuretic hormone, and that antidiuretic hormone enters the blood. It will cause vasoconstriction of blood vessels, and it will also act on the kidneys there to cause more water to be reabsorbed, and that then increases your blood volume and increases your blood pressure. The third one then is atrial natriuretic peptide. Wherever you see the word natriuretic, you know we're talking about sodium, okay? Now this is the antagonistic hormone to aldosterone. Because aldosterone causes sodium reabsorption from the filtrate, this hormone is going to promote sodium excretion. Okay, so this atrial natriuretic peptide is released from cardiac muscle cells when atrial blood pressure increases. It does promote sodium excretion, and that will therefore stimulate an increase in urine production. By increasing your urine production, that's going to cause a decrease in blood volume and a decrease in blood pressure. And this one takes hours to days to work. So just to summarize the connection between renin, angiotensin and aldosterone with antidiuretic hormone and atrial natriuretic peptide. With renin, angiotensin, and aldosterone, it involves the kidneys, of course, and plasma. The net result is vasoconstriction and sodium retention from the kidneys back into the blood, and water will follow. So the net effect of renin, angiotensin, aldosterone is to increase your blood pressure. Antidiuretic hormone, of course, involves the hypothalamus, those osmoreceptors in the hypothalamus, release of antidiuretic hormone then from the posterior pituitary. And the net effect of antidiuretic hormone release is vasoconstriction and water retention to increase your blood pressure. And then atrial natriuretic peptide is released by cardiac muscle cells, and it will cause a loss of sodium and water, and the net effect of that then is to decrease your blood pressure. So just take note of the involvement of the renal system in all of this and how these three hormones sort of interrelate. All right, the other two mechanisms that are involved in blood pressure regulation are the fluid shift mechanism and the stress relaxation response. With the fluid shift, as its name suggests, fluid is moving. So there's a movement of fluid from the tissue fluid, so from the interstitial spaces back into the capillaries in response to a decrease in blood pressure to maintain blood volume, and vice versa. So if there's an increase in blood pressure, you'd get movement of fluid out of the capillaries into the interstitial spaces. And again, this one takes kind of minutes to hours to sort of have an effect. The stress relaxation response then involves the adjustment of blood vessel smooth muscle to respond to change in blood volume. Okay, so for example, and this is going to make complete sense too, when blood volume suddenly declines and pressure drops, you're going to get smooth muscle contraction to try to increase that peripheral resistance. And vice versa then, when you get blood volume increasing and pressure increasing, you're going to get smooth muscle relaxation. And again, this one takes minutes to hours to kick in. So that's all I'm going to talk about in terms of blood pressure regulation. Briefly look at the effects of exercise on blood vessels, and this list here is definitely not complete, but as you all know, exercise does promote cardiovascular health in general in several ways. Firstly, going back to the heart topic, we mentioned that the athletic heart, so the trained heart, is larger, so stroke volume increases. And so the athletic heart then can deliver the same amount of blood as an untrained heart, but with a lower heart rate. And this allows the heart to be more efficient, right? And allows the athlete to exercise for longer periods of time before the muscles start to fatigue, and overall then places less stress on the heart as well. Exercise does lower the overall cholesterol levels by removing, a very sort of complex mixture of cholesterol and triglycerides called low density lipoproteins. And the removal of this, decreases the risk of cardiovascular disease because they are highly associated with that. Exercise also promotes the health of vessels by decreasing the rate of plaque formation and reducing blood pressure. So the heart doesn't have to generate then as much force to overcome resistance if you have that plaque forming. And finally, just on a bit of a clinical note, looking at how sort of shock affects vascular health as well. What is the definition of shock? It's the inadequate blood flow throughout the body. And as you move through your course, many of you will learn lots and lots more about the different types of shock. So they include hypovolemic shock, where there's too little blood in the circulature; cardiogenic shock, where the heart fails; vascular shock, where the arteries dilate; and then there's neurogenic shock, anaphylactic shock, some of you may know about, which is that severe consequence of an allergic reaction that results in anaphylaxis as well, where you get systemic vasodilation and also obstructive shock as well. There are 3 stages of shock, and these are called compensated, progressive, and irreversible. With compensated shock, the blood pressure decreases only a moderate amount, and all of the physiological mechanisms that I've been talking about are able to re-establish normal blood pressure and blood flow, and everything's fine. However, if that doesn't work, it then progresses into progressive shock, where these mechanisms can't are inadequate, and positive feedback cycle develops. And that cycle then, unfortunately, will proceed to the next stage unless there is sort of medical intervention, which reestablishes adequate blood flow to tissues. And unfortunately, because it is this positive feedback cycle, once it gets to that irreversible stage, that does lead to death regardless of medical intervention. Okay, everybody, I have finished this topic, and we have finished the cardiovascular system overall. So you can all give yourselves a big, big clap. When we come back, we're going to be talking about the lymphatic system and also the immune system. So I'll see you all shortly.